All right, settle in, settle in.
It's a different band every
Settle in,
day.
everybody, settle in. Okay, we're talking about feet problems, is that right? Shoulder, sorry, wrong one here. So whoever's had shoulder problem before, who's ever had a shoulder problem before? I have. You know, it's life. And sometimes the neck issue, sometimes shoulder, sometimes upper back, it's all connected for one too. Yeah. So my biggest thing is understanding, I'm a chiropractor, if you haven't seen me before, thinking new people today. I work with a lot of patients that have pains, maybe spine, maybe shoulder, elbow, wrist, knees, feet, anything. Okay. So part of what I want to do is assess it properly to where, is it really a shoulder, or is it a neck, or is it upper back, or a combination of all three sometimes. You can just there's probably, I think, maybe 4 over there, 3, 4 over there, so thank you, appreciate it. So part of it is, the shoulder itself, if you want to call it the shoulder, is going to be here, at the point of your shoulder. You have about 6 muscles around that area. You have your upper trap up here, okay, the one up here that connects from your shoulder to your neck. You have your posterior delt muscle, which is part of your shoulder that goes backwards. You have your medial delt, get your shoulder come up. Anterior delt that helps come up this way, you can come inside too. Okay? So you worry about muscles that you can come underneath teres major, teres minor, along with pec minor that attaches in front to help internal rotation, and also your bicep that allows you to help with elevation. A lot of muscles control the shoulder. So you want to see how do you make these muscles if you have a shoulder problem. One thing, understanding where it's coming from. Is the shoulder problem coming from an injury? Do you lift something too heavy? Did you sleep on the shoulder? I have 2 patients this week come in because they slept on the shoulder wrong. But they had a problem where overall, sometimes the shoulder is too far forward, coming this way, relative to staying backwards. That can cause injury, especially if you have lifting issues or things where you have to lift yourself even out of bed sometimes too. So you want to make sure we look at the shoulder problem in the sense where which muscle it might be, and is it also causing long-term, say over 3 months, where the shoulder has now rolled forward and in because it's weak or tight or uncomfortable. Okay? When you have a shoulder problem, we want to sometimes, as a person, we have the injury, limit our motion coming up, which can even coming back because it hurts too much. So now we focus on doing this, causing more issues. So one thing I do with people too, when I see that, is how they sit. If they're sitting back here more, say for work, if they work sitting a lot for their position or job, or even at home too, or they sit more like this. You sit like this, that'll cause a shoulder problem without lifting. Okay? Even when they're standing too, I always talk to them about one thing. What I do too, if you're new to my classes, I always videotape to come up on a YouTube later. At the bottom of your sheet from the outline, you can see there are 2 ways to find it on our YouTube. All right? So here, I have people sitting stand against a wall too and see their posture. Are they more against the wall flat with their head, shoulders, hips, and heels, or are they coming more forward with their back is more rounded? That'll tell me also, are the front muscles tight in the front? Or the back muscles weak? We want to check everything in detail. Can we sit back here naturally, we feel relaxed? Even also, is one side higher than the other? That'll tell me that shoulder is more the injured shoulder because more guarded, more tight. Besides the position and posture, we'll also look for, are there tight or sore muscles in the area? It gives you more of a clue of what to look for. Right? Any questions so far? Anything? I like the quietness. Sometimes. So, range of motion of the shoulder. Let's do it more standing. You see standing. I want to check with a patient. Do they have all, I'm going to call them 6 ranges of motion, maybe even 5. Here, where they can come here. Are their hands naturally at their sides, where their hands are pointing, thumbs pointing forward, or is their hands more turned back when they stand? This tells you the hands are turning back, that their front muscles are pulling everything into rotation, or it's being more neutral. Also, when you check the range of motion, how far can they go up with their hand or arm without causing pain? Is it more horizontal? Can they go all the way up? And are both sides even when they come up, or is one side a little bit lower than the other? All right, so for example, I had someone come in, David, yesterday, lineman. He'd come up here, he's fine here, even, comes up here, he goes, I can't bring my left arm further up than that. He's stuck kind of here. So, and more chronic pain, more injury pain too. So I'm looking for different things also to look for besides coming in. Also, do they have range of motion coming in this way? And also coming out external rotation. If they have problems coming in, that can be more of a strained muscle in the front. Problems coming back, more tight muscle in the front or weak muscle in the back. Realize for your muscles to stay even here, where the shoulders stay back over, say the seam of my shirt to my ear, these muscles in front, the pec minor, anterior delt, posterior delt, upper trap, have to be evenly strong and not imbalancedly tight or weak on front or back, which is it's work, but I always go back to posture. Can you keep your posture here? These muscles stay even versus as we come forward, these muscles start to turn themselves in and hunch. All right, any questions? Nothing? Fantastic. Also, what you want to do is it hard to bring your hand up this way with your palm coming up? If it is, I'll test them to see if it's actually the bicep tendon, this muscle here. You see that muscle? See it? Everybody ready? Not too bad. Working on it.
The guns are out.
The guns are out. Is here where I'll push their hand down. If that hurts up here, the bicep attaches to a groove in the shoulder. Looking for that too, as an injury point. A bicep injury, not just a shoulder injury. All right, so we look for different things. The assessment helps me to figure out. And also, what do you think is chronic versus acute? What do you think that means? So it has a chronic injury versus acute injury. Go ahead.
Chronic is when we have for a long time.
Long time.
Acute when it's less than 3 days.
Exactly. And I say a long time, like about 2 to 3 months. Not getting better. Where then 2 to 3 months, now the muscles have really adapted to prevent that injury from causing more pain. 2 to 3 days, the muscles don't look very balanced, but they may have more soreness in that area, so we'll calm that down with more icing, more therapy for one too. All right, any questions here? That's the assessment. Now, once you check motion, what's sore and painful, how do you start stretching? Okay, number thing I do with my patients to keep it very simple, have them lie on one of my beds. I'll use the mat here. What I have them do is take a water bottle. And I tell people before too, any brand works. Doesn't have to be Costco. Doesn't have to be Costco. So I'll go here right now for people at home. So here, I'll have them do is lie, see if their left shoulder's injured. Have them lie on their back here. And then take that water bottle, start with their elbow next to their side, just to start. I'll have them slowly come out where it gets uncomfortable or a little sore. Might be right there, or they might be able to drop all the way down. Okay, where they can go. Okay, if this feels good, we can go all the way down, almost horizontal to the body, propel to the body. At that point, now is go maybe 45 degrees, do the same thing, because it'll be a little bit tighter. See if that feels good. Okay, if that feels good, then we're going to go up here, 90 degrees to the body, 90 degrees, and then slowly come back. Gets tight here. I'm going to have them hold that. If that's tight, hold that for about a minute to let their shoulders slowly unwind that shoulder joint. Any questions about that? All right, so what happens is shoulder gets tight. It wants to wind in here, coming in this way. You want to unwind slowly this way. Using water ball just to start, we're going to come out again and let that water ball slowly fall out to unwind the shoulder here next to the body for one. Here, as it gets more difficult, here, it's really tight. Here, you'll feel that pressure coming backwards, okay? I like the bed or the floor or the couch because it allows you to slowly relax in the stretch versus wanting to push it to where you can cause more injury. That feels good. What I do next, get this one out of the way too. Here. Out of the way. I'll need a volunteer in a second for this one. I'll use the wall again over here. I'm going to use someone's just their tension on their body to slowly, here, against the wall, so their body against the wall completely. I'm going to have, whether it stays their left shoulder, have them walk out the right leg and turn their body, pivot their body away as you use your right hand to push a little bit to cause some tension on the shoulder. But having the hand down here allows you to stretch out that pec minor, anterior delt muscle to open up that shoulder more this way versus being turned in. So here you can control the stretch by coming here against the wall first. Slowly walk your right foot out for your left shoulder. Let your body slowly come out where it feels uncomfortable. Hold that 30 seconds. Then relax and repeat about 3 times. That's easy. We're gonna come now horizontal with the body, and then slowly walk out again, using your right hand to push yourself out, to feel more tension. Wherever you feel that uncomfortableness position, hold that for 30 seconds. Again, one more time. Now up here, I'm gonna go actually more of an angle here, and then come out again, push yourself out. Okay, any questions about that? Who wants to try this? Any volunteers? Come on over. Let's see. You got it, you got it. What's your name?
Christina.
Christina, tell me, nice to meet you.
Nice to meet you.
Come on over, so I can start with this one first, just like this. All right. And now with this hand right there, turn your right foot out. Good, move your right foot out. There we go. Right here. And now slowly push with this hand to straighten your elbow out. There we go, right there. And then push the elbow out this way. So turn your body. There we go. But push with your hand to turn your body. Where do you feel that stretch? Where do you feel a stretch, Christina?
My back.
Right back here?
Yeah, shoulder, back.
So part of it too, what else controls the shoulder is your upper back. That's part of the shoulder complex, along with the neck too. So she's feeling it here, where it doesn't want to move in for one. Do you feel it here also?
Mm-hmm.
Yeah, so she feels the front too, the pec minor, anterior delt, that muscle also being stretched. Now go back to neutral, facing the wall. Bring that hand up here. Now again, with your hand here, push yourself out, turn your foot out too. Actually, other foot. Right foot out, there we go. And then turn your body this way. How's that feel? Relief.
Yeah.
So stretch inside
It's straight from my back.
and the back too. So trying to get the blade will actually come in when it should move normally. First can't move normally, it's step back here, also helping the shoulders stay sore tight. One more position. Up here, Christina. Start over. Bring your body out again. How does that feel? Another relief. And again, front muscle and all of the back, correct? Yeah. So 30 seconds. So your homework would be 30 seconds low, 30 seconds middle, 30 seconds up. All right?
But these two sides are different heights, right?
Yeah, right here. Yeah, you're a little higher on that right-hand side.
Right.
Yeah.
What happened?
What happened is, I don't have a crystal ball, but I would say, is your muscles are tighter here than here.
Oh.
Because when it gets tighter in your shoulder, that shoulder will actually rise up and come in to guard and protect it. So you gotta watch for that. If whatever is tighter, it'll be tighter, make those muscles pop out, keep this one low. Yeah, the longer it becomes your normal, you have to get that fixed by dropping it down, rotating it back.
Oh, so that way, here it's not hump anymore.
Exactly. So instead of coming here where it's going to hump forward, you want to bring your shoulder back, so it brings that, depresses that scapula back to neutral. Yeah. All right. Okay, Christine. So work on both sides. 30 seconds.
Thank you very much.
Why she is in pain?
Well, and also, Christina, to make sure when you do the stretching, make sure you go the too. Okay, get to the part. If it's uncomfortable, that's where you want to stretch.
Why she's in pain then? Maybe she would herself or what?
We'll check and see. But it could be a couple of things. But I always like to focus on one part at a time to know what's going on with it, and look at the big picture overall. So that's be the goal. That's what we normally do. You know what I do. Next one. This one's a tough one. Let me see if I brought my bandage or not. We're going to do some time to know. So here, this is a tough one for people who have a shoulder issue.
Oh.
I call this the broomstick stretch.
Broomstick, here the list.
Yes, I use this one for neck issues, upper back issues, for back issues like you have too, Christina. Is here we want to do is take that broomstick and go back as far as you can. Hold that stretch if that's comfortable for you, where it feels like the point for you, and then come back forward. What it'll do is get the whole shoulder to go from being forward. So now you're stretching the neck, upper back, and shoulder to come back here more instead of being here. Even the front pec muscles too, they open themselves up. You want to lengthen the muscle, get things moving backwards versus up. So if you're comfortable, you can go either wherever you're comfortable, hold that position for 5 seconds, do that 5 times. Or if you can't, if you're comfortable, go back all the way, then come forward. Yay, right? Easy all the day. I hurt my shoulder before, so I do it every day so it stays loose. If I don't do it, it's gonna hurt. So every day I stretch it. Again, 5 here, all the way back, and all the way forward. Again, if you're uncomfortable with that, go where you feel comfortable. Where you feel a little uncomfortable, hold that position for 5 seconds and do that 5 times.
That's for the back.
That's for the upper back, shoulder, and neck. The whole upper body can roll backwards now instead of being stuck here. And if we have this position here, you've affected all the muscles of the upper body to stay here. Let's unwind everything backwards. Maybe at that point things come back here instead of being stuck forward. All right. Any questions about that one? That's the ooh one. That's a tough one.
Excuse me,
Yes.
you do that daily?
Every day.
Every day.
How often should we stretch people?
Every day.
Every day. Okay. Every day. I stretch every morning. And if you have a shoulder issue, I would do all of these every day until you feel comfortable doing just strength. But I do this, I keep this in my pantry next to my coffee maker. Every day I stretch before I go to the gym. And you don't have to go to Home Depot, get a PVC pipe, 1/2 inch, whatever you want to use. Just any stick works. As long as it's wide enough for you, if you can go back at least back here, then come back down if you can. All right, but every day we should stretch so you don't have rigor mortis. That'd be bad, right?
And those sticks can be from an old mop
It
stick.
could be anything.
Yeah.
A Swiffer, anything you use. I've had this for at least 15 years from Home Depot.
Yeah, but that looks official, yeah.
Yeah, whatever, you know. But it's like my office, once it works, it still works.
The dumpsters, you go around and fight them.
If you want, just watch out for splinters and stuff. Be careful. Cause other injuries. Now, how do you make the muscles? If we start going, okay, I feel pretty good. My back feels good. My shoulder feels pretty good. How do I, the problem is when I sit too long or stand too long, it still rolls forward. I still feel like this.
Yeah.
See how it
Or I
is?
get in bed and go, man, my shoulders still hurt. We have to work on strength. That is the plan. When your shoulder gets strong from an injury, for example, for stretching first, doing the rehab, getting stronger, it can stay strong, it's not going to hurt. If during COVID, what happened? All the gyms closed for 6 months. All I had at home was my wife's 5-pound pink weights. I can only do so many shoulder presses if I lose count. I can do 100 and I'm okay. So going back to weights for me was my ability to get my shoulders stronger again. I needed the weights to do that. So we get to weight to the point where we can actually lift weights, keep it strong. That's the good plan for you. So number one, here I used to use the wall a lot. I just want people to have good posture too. That's the plan. So here, you're going to take those two, a second Costco water bottle, whatever you have at home, whatever your sponsorship is. Mine's Costco. I take these two. I don't want to do a shrug this way, okay? Because I'm just reinforcing bad posture, bad position on my brain to reset my body back here, right? And also want to open my hands up to make sure if I have front pec minor, anterior delt tightness, I want to open everything up back here to have good position, good posture. Take those water bottles, I call it an open hand shrug here, my modification. We come here, and then put the hand against the wall and slide your shoulders, back of your shoulders back here, up, and make that upper trap muscle which attaches to your AC joint, C1, C2 in your neck, upper back, T3, T4. Make that muscle stronger to hold your body up. Here, take those water bottles, slide up where you feel comfortable, hold for about 5 seconds, and come back down about 5 times. So again, coming up, hands open, come up, hold for 5 seconds, and come back down. So we can sit up here instead of hunching forward. Who wants to try this easy one? Before the hard, let's try this one. Anybody? Come on over, sir. What's your name?
Jeff.
Jeff Tony, nice to meet you.
Nice to meet you as well.
Take my sponsors.
Your
Right there, my Costco's. Hold it right there, good. What you want to do is really keep those shoulders back, and also, one thing I forgot too, head back too, at the same time, good. And with your head too, Jeff, do me a favor. Instead of doing this, come back, bring your chin level and come back straight back. There we go, perfect, good. Bring those elbows straight up, good. Hold for a second, hold for 5, 1, 2, 3, 3.5, 3/4, 4, and 5, good. Does that feel okay?
Yeah.
Where do you feel the stretch, where do you feel the tightness?
Right in here.
Perfect. You want to feel these muscles here, Jeff, the upper trap attacks again here, to your neck, upper back. So if you have any soreness, you may feel it more out here, you may feel it back here. You're going to work the whole muscle 5 times, hold for 5 seconds. All right, one more time, Jeff. See how it feels? Your feet gets hold. Your feet gets hold. Always good posture, sir. Good. Up, hold for a second. Good, 5, and back down. And make sure you smile too.
And breathe.
And breathe.
Never breathe right.
Yeah, and what's, if you don't want the breathing with this one, you're gonna breathe in, hold, and then relax. When you use to, Jeff, do one thing you can do with the shoulder blades also, bring it in a little bit, so you pinch a little bit as you come up, and then come back down. Does that feel different?
Mm-hmm.
Good. Hold and relax. Work on that strength. I like the hands over to you. Do you feel a taste of the shoulder? Do you feel tightness here?
A little bit right here.
And the bicycle tight. That common when we're here a lot, we'll make it a little more tight coming up. So we'll get the stretch in there while you're doing the exercise.
Cool.
Remember, Jeff?
Yeah.
Good. Again, smile. We all should be. All right.
Had to be alive.
Yes. I breathe today.
Yes.
Just work. Did you
It's
show
hard to
injuries?
remember to breathe.
This left shoulder,
What hurts?
like you're putting a glass in the cover.
Okay, so your stretch for that one, just to work with Jeff a little bit. Hold that for 1 second.
Sure.
And bring that elbow here and come straight back. So here, hold that, and then keep your elbow. How's that feel? There's the face. There's the face. Come back down,
Try it.
all the way horizontal, and come back down. So the one on the floor or the bed, edge of the bed, using your hand off, would be good for you. This is good. I don't go without this coming here. Coming straight back. Let that, with the one on the floor of the bed, it's almost holding that stretch, let your shoulders slowly relax into it, so you feel the full range of motion.
You know what I do? Looser.
You gotta unwind that shoulder.
Yeah.
It's work, my friend.
That's been years, like many years.
That's work. It's just work.
Yeah.
If I don't stretch a couple days in a row, my shoulder gets tight. Thank you, Jeff.
Thank you.
Remember, smile more, okay? You got it.
Safer.
Another one. I kind of jumped a little bit. 3 shoulder exercise.
And
Another
then
one
you can
before
tell
too.
if you're doing it right.
I like the wall again, same thing. 3 shoulder exercise. How many exercises do you think is this? In this exercise, how many different exercises are in this exercise, you think? The 3 shoulder exercise.
3.
Want to make sure we're awake here. This is a 3 exercise in one exercise, you want to call that. Okay. This is to make sure the muscles get, again, further back here, along with the upper back here too. This upper back also contract in, even back here, contract into between the traps and make your muscles stronger again to do what? Hold your body back instead of staying where you were before. All right, so number 1, we want to extra rotate the shoulders out here instead of being stuck in here. We want to open up and lengthen the pec minor here, along with the anterior delt and some of the bicep we talked about, Jeff, too. Get that bicep more open. What you do is take that here, the water bottles, against the wall again, nice and flat, head against the wall. Always want to reinforce good posture and bring those water bottles out as far as you can. Okay? People do like, yeah, I got this, no problem, doc. I'm like, no, this is not a fly exercise. Here, elbows locked in the whole time. Number 1, come out, hold for a second, and then come back in. Recommend start with 5, work to 10. Okay, for exercise 1 of 3. Second one now, we want to do this one here, against the wall again. We did a second ago with Jeff. Here, all the way back as far as you can go. Hold for a second, and come back in, horizontal. And again, smile. Forgot to smile, Jeff, sorry. All the way up. And then down 5 times. Okay, that works these back muscles back here, the posterior delt, part of the trapezius minor, get them to get you stronger here, so we stay in this position here instead of being slunched forward. All right? Any questions about that? Yes.
No, I think that's number 2.
Number 2. Number 2 of 3. 2 of 3. We'll call it that.
Number 3 is coming, huh?
Good. Number 3 of 3. Hey, a surprise, surprise. Now we're going to work on not just the muscles getting up here and back. We're going to work on these muscles back here too, the rhomboids and upper traps here. Get them in more so your whole body can set back here instead of being forward. All right, so now we're going to do, so we flatten the wall. Instead of that, we're going to do hips on the wall, feet off the wall, legs kind of straight, don't lock them out, kind of straight. head up the whole time. Take the water bottles, put them forward, my thumb's pointing forward. That one I'm doing is lean forward a little bit, hinge forward, come up, hold for a second, then come back down. Again, head stays up the whole time. I'm coming up, hands are about the same level of my shoulder, hold for a second, come back down. It's a reverse fly modification on the wall, so you don't hurt your back. So you see from behind too, what happened back here, I'm gonna come up, hold, pinch my shoulder blades together, then come back down. Again, 5 of those. Who wants to try this one? Any takers? You guys good? All right, we're good. I'll get you guys next time. Last one. I like this one seated, okay? I'll show you this one here. This is, if everything else feels good, then I progress my patients to this. This is kind of tough because it hits the neck, upper back, and shoulder together. We want to get stronger, right? So I want to do a shoulder press, but I don't want to do it like this. I want to do it like this. So I'll start someone getting water bottles here. I'm going to do is have them sit forward in the chair and come with your hands out, come straight up, hold, come straight down. The goal is to make sure if we start here, because the shoulders might be tight still, the goal is to get to where you can get your arms parallel with your body over time and go up. If that's not comfortable, start here at an angle, then come up if the shoulders are too tight. Then slowly work yourself out to here, hold for a second, come up, hold, and then drop down your side again. Take a breath, again, smile, and then come back. About 5 of those start and go to 10. It just works, but it takes the work. Jeff, was that sore when you did the stretch back here?
Yeah.
Are you okay?
Oh, yeah.
Are you alive?
I mean, in this one now, no, I'm fine.
No, but we want to be, what I mean is we want to be a little sore when we do the stretch. We want to feel uncomfortable. Not where it feels painful where you want to guard and tighten. We want to be uncomfortable where if you feel like if it's actually moving.
Yeah.
Okay? And if you are sore afterwards, you even have to start stretching too. Always ice the shoulder. Not heat, ice. Heat's for old people. You're not old enough yet. Okay? Old people. Alright? So only ice, not heat. Any questions? Any questions? So I'll have this on YouTube, and probably, I don't have time today, probably tomorrow, I'll put it on YouTube. You'll see this workshop again, and it might finish on the very bottom too if you have any questions for me. Exercising how often?
Every day.
Monday through Sunday. I tell my younger patients, the days that end with Y. Which is Tuesday. Alright? Any other questions at all?
Do these exercises prevent rotator cuff?
Yes. Increased range of motion. Basic question is, does it prevent or reduce the risk of rotator cuff injuries? Yes. Because we're staying loose and strong, so if something does happen, we can recover faster and we don't have an injury. Yes, sir.
So how many days?
How often you should do it? How many days?
How many days for exercise?
Every day. Every day. And as you feel stronger with the exercise or more flexibility, then add more reps, add more times doing it. And if you're comfortable, you can add a little more weight. This is about maybe a pound or so. Maybe go to 2, maybe go to 5. But if you have to make sure, again, the question, we want to make sure the stretches feel good first. Okay, they feel like, okay, I have full range of motion, feels tight, but I have full range of motion. Then you want to add the weights in. Okay, especially the military press. You want to make sure, military press, if you're sore doing this the whole time, it's not going to help you. So make sure you use a light enough weight to start with that and build up over time. But if you have a shoulder injury, every day, stretch. I stretch my shoulders every day. I work out my shoulders 3 days a week. That's my routine. I push people around all day. Good job. But, any other questions?
Yeah,
Yes,
when I exercise, it make a noise
clicks,
this area mostly,
clicks.
and it's because already that it's an injury.
No, because the joint's too tight. So by doing the stretches where you come back more, like the one on the floor, where you come back and hold that, that'll make the joint unwind to make it looser. Because the joint's too tight, it's causing that clicking sound. It's making, it's called the AC joint on top of your shoulder, which is your part of your shoulder and also your clavicle. that joint has now rolled forward and in instead of being open and back. So stretching for you would be good. Do your normal routine, but stretch first, and then do your exercise afterwards. So those first 3 ones you saw in there, do them first, and then exercise afterwards. You'll feel that clicking away as the pressure reduces, because now the joint's looser. See, we can work at strength all day, right? If we're not flexible, then that can cause an injury. So I just tell people, stretch first, and then exercise afterwards. I go to the gym, after I stretch at home, go to the gym, walk 5 minutes on treadmill, and then I do 3-4 stretch, or even do my own workout. So it's almost making sure I'm loose enough to do whatever I want to do. And still crack backs and necks all day. My routine.
Excuse
All
me.
right. Yes.
What do you do? Turn around, bend down?
I like the ones that we did today where you want to focus on external rotation here. So you want to make sure we're coming back more here and also coming into like this. We're getting everything go back and open versus right now we're closed off a lot. Anyone with shoulder injury, we naturally want to make things tighter in, want to open everything up. So that's good. So similar thing, shoulder injury recovery is always extension, external rotation, not coming in more. Focus on just coming back. You know, the wall ones too, even a door frame, use the door frame and push on the door frame, push your body through the door to open up those muscles. Your pec minor muscles here are the strongest muscle of your shoulders. So you want to make sure you keep them stretched out the whole time. All right? Any other questions? And you'll see the videos again on YouTube and probably by morning. I'm on there.
Will you show us the one on the door?
Sure. Right here? Of course. This one here. Yeah, we're at that one. Yeah, we're good. You guys okay on film? So here, I'm going to have Anna come hold the door open for me. Okay.
You have to go hold the door.
So here, take the door frame, here, hands about shoulder height, and then slowly bring 1 foot forward and walk yourself into the door. Hold that stretch, maybe 10 seconds, maybe hold it 10 seconds or so, and then relax. Just for fun, switch legs so you remember which one you're on.
Hey.
And then again, hold for 10 seconds, hold for 10 seconds right there. And then probably, I would do 4 sets. So I switch legs so I know which ones to do. Here's my second one, 10 seconds. Again here. Third one, 10 seconds. The last one is shoulder height the whole time, 10 seconds here. All right?
Thank you.
Welcome, of course. I can demonstrate anything. All right? Any other questions? Anything? About life? What's increased longevity? How to live forever? It's just stretching, you know. Just to take is always stretch every muscle every day. Okay. When you wake up in the morning, do you feel tight? I do.
Yes.
I'm gonna go home. Eat some quick food, head back for work in about probably 40 minutes. I'll take a 10-minute nap, wake up and go, I'm tight again. You stretch again. It's just part of life. But we have to stretch every muscle of our body, especially when it's tight, so it avoids injury. Especially injuries that happen with no trauma. Yes. How do we wake up and go, my neck hurts? Well, it wasn't your pillow. Something that happened the day before. You know, it just takes work to stretch. But we stretch every day, all of our muscles, or most of them, and less chance of injury tomorrow. Yes.
Question. If you strain today, would you wait a few days before you stretch?
I would stretch out. If I straighten, I would still stretch where I feel uncomfortable, but ice afterwards. I like the ice gets inflammation down to allow help heal the process.
For how long?
Ice for about 10 minutes.
10 minutes.
Upper, like bigger body parts, maybe 15. At least 10 minutes on smaller joints, like a shoulder, elbow. But enough where it starts to burn a little bit to make underneath the skin more in the joint space.
Wrap it up in a towel or something?
I would know. You're tough.
Oh, yeah.
I would use a t-shirt.
It looks
A
like a
t-shirt.
puppy.
A t-shirt has a t-shirt's all you need. Just a t-shirt, or like a thin material like this. Or if you want to on your skin, use a paper towel. I like Bounty. It's my sponsor too. Bounty. All right. Any other questions, comments, concerns? Good. The next one talk is
We didn't get the paper.
I don't know, it's out front somewhere, it's out front.
Okay.
I'm here every Wednesday, third Wednesday of the month, hope you're entertained, hope you learned something, that's all I hope for. Have a good day.
Thank you.
Thank you.
Long job. Tip your waiters, waitresses, please, do it well.
Before I leave, I want to
Yes,
thank you.
yes.